interviewed about 5,000 women with a response rate of 80%, and we had some qualitative explorations as well as the provider study also. I'm not going to spend time on this table, but as you would see, these are young women, married early, less educated, typical of Rajasthan. So what are our findings about the reach of this scheme? How many women are reached by the JSY? In a state like Rajasthan, which is a low-performing state, according to the government classification, all women are eligible for availing of JSY. But we find that fewer than half had received the cash. And slightly more urban than rural women had received the benefit, 52% versus 45%. And when we look at the facility or the place in which they have delivered, we see that among those who had delivered at eligible government or private facility, by which I mean, primary health centers, the model sub-centers, community health center, accredited private facilities, 92% had received the cash. And among eligible women who had delivered at home, by which I mean, women who are aged 19 and above, belonging to poor households and having their first or second live birth, we see that just one woman had received the cash. And a negligible minority of non-eligible women, like those who are delivering at home with a high parity, or those who are delivering in a non-accredited private hospitals or in transit, also reported that, a small minority, but 4% reported that they had received the cash. Is it reaching the most vulnerable? This slide shows the differentials by age, religion, and economic status. And we see that women who had delivered at young ages, that's less than 18 years of age, and at ages 30 to 34 were less likely than others to have received the cash. Religious differences are also notable. Women belonging to Muslim and other religions were less likely than Hindu women to have received the cash. Economic status differentials are also observed. Women belonging to poorer households were less likely than others to have received the cash. So were women with no schooling. Has there been a change, either positive or negative, in the quality of maternal and newborn care with the introduction of JSY? We looked at this question by comparing the experiences during pre-JSY birth as well as the most recent birth of a matched sample of women who had experienced both pre and post-JSY birth. The match sample was arrived at by using propensity score matching, and women were categorized into JSY beneficiaries and non-beneficiaries based on whether they had received JSY cash for the most recent birth. We also did analyze the net effect of JSY, using difference in difference estimation. Our study contained a lot of indicators to look at the quality of maternal care. I have selected a few indicators for this presentation. In the area of antenatal services, we looked at the extent to which women had received comprehensive information about pregnancy care, the extent to which women had received comprehensive care whenever she had gone for an antenatal checkup, and also a measure of client-provider interaction. As you would see from this slide, there has been change in a couple of indicators like the information received or the care received, and increase in the number of items about which information was received between pre and post JSY birth was slightly larger among the beneficiaries than non-beneficiaries. So is about the comprehensive care, but we don't see any change in the quality or the nature of the client-provider interaction. The bottom line remains that the quality is poor, but still there is a difference when you compare the experience over time among the beneficiaries and non-beneficiaries. In the area of delivery services, again, a few indicators I selected for this presentation. We looked at whether the healthcare provider has conducted the basic checkups prior to delivery, whether the provider was available when the woman reached the facility and they behaved nicely with her, whether she was discharged after 24 hours, and whether they allowed the escort to remain with her, escort stay with them during the delivery. We see an improvement. Especially a more considerable improvement among the beneficiaries than among non-beneficiaries. looking at the quality of postpartum services, I had included 2 indicators which measured whether the women had her blood pressure, temperature, or vaginal bleeding had been checked when she had a postpartum checkup, and whether she had received comprehensive information related to self-care as well as the care of the newborn. The first set of bars shows that there has been no change between pre and post JSY period in the extent to which women received comprehensive checkups during the postpartum period. The second set of bars shows that there has been improvement over time, but it has been similar levels of improvements were reported by both the beneficiaries and non-beneficiaries. Finally, in the area of newborn care practices, 3 indicators we used included whether the newborn has received comprehensive immediate care, whether the mother had followed appropriate feeding practices, and whether the infant's age more than 4 months have received full immunization as defined in this slide. Irrespective of the indicator, we see that there has been improvement, and improvements has been reported largely by the beneficiaries than non-beneficiaries, whether it is in the practice of comprehensive immediate care of the newborn or following appropriate feeding practices or in terms of full immunization. This table just summarizes the results of the regression analysis using the difference in difference estimation, and it reiterates that the experience with the introduction of JSY has been mixed. There has been some areas which improved, like in terms of provision of information, in terms of provision of comprehensive care, but no change in terms of the client-provider interaction. Similar changes in the area of delivery services, some good practices like women are getting discharged, at least they are kept in the hospital at least for a day, and they're allowed to keep their escort to remain with them. But no change in the area of postpartum care, largely positive change with regard to newborn care practices. As I mentioned, we also had collected some qualitative insights, and women's perceptions also reflect a mixed picture. There are a sizable number of women who reported that there has been improvement in several areas, like better provision of information on MCH, like this woman who said, earlier we did not get much advice or information, but now they are advising us about everything. There is safer management of delivery, better treatment at the facility by the provider, and improved access to services. There's the other side, a small minority who pursued no improvement and wondered, what do they do with the money if they had to face a problem and spend more money? And they also felt that there's no guarantee that the child would be delivered properly or would come home alive. So in conclusion, I would say, our study shows that the reach of JSY remains inequitable. The most vulnerable are less likely than others to have received the benefit. Evidence on the quality of service is mixed. There has been positive changes or no change. And that poses a big question for us. What facilitated that positive change in certain areas, and what prevented certain aspects of quality of care just remain as were, before the introduction of JSY? And we also need to, keep in mind that there is change, but the levels are still low. They are statistically significant, but is that what we should be accepting for? So I think the program has been positive in getting women to the facilities, which others might, we can debate whether that's a good thing enough. But still, I think we need to work towards ensuring the reach of the scheme to the most vulnerable, and at the same time, pay more attention on improving the quality of service. And from our research, we have this data from the provider aspects, and the next step for us is to look at why certain things change and why some of the things remain stable. So I will conclude with expressing my sincere gratitude to these organizers for inviting us to make this presentation in this excellent conference. Thank you so much.